My name's Paul Mayer. I'm a partner here at the Bonadillo Group. Thanks for joining us for our annual tax-exempt webinar series. Hopefully, you've been joining some of our other sessions and enjoying those sessions so far. I know we have a full plate of sessions, so hopefully it's very informative for you. Presentation materials and links to our webinar replays will be sent to you via email within 2 weeks after the event concludes. If you haven't registered for the remaining sessions yet, there's still time. Go to bonadillo.com and search for tax-exempt webinar series to sign up. The link will also be placed in this chat. Let's see if at the conclusion of the session, we'll go over some things as well, but just wanted to let people know if you have questions, I'll try to leave a few minutes at the end to answer yours. And if not, you can always feel free to reach out to me at your convenience. I'm always available. Please don't hesitate to do so. So today we're going to talk about, give you a little update for a lot of you. I recognize a lot of people on in this session. Thanks for joining. Happy New Year to most of you. Although we're at the end of January, so not really a new year anymore, but Happy New Year regardless. Today we're going to talk about some of the compliance program regulations updates from 2 years ago. I can't believe we're beyond 2 years at this point, but it still feels really new because the last time the compliance program regulations were updated were back in 2009 when they first were implemented. So we went almost 13, 14 years before they were updated and changed. So we're going to go through some of those real briefly. For those that it's seasoned compliance professionals, it'll just be an update for you. It's always good to hear things again. And for those who are new to compliance or you have some other roles within your organization, it'll be some good information for you to have and take back to your organization. Also, we're going to go through some of our survey results. We've done some workforce surveys throughout the past year and a half or so, as well as our most recent compliance officer survey. And we'll get through those, some good information there. Okay. Make sure you can see the content. Be sure your speakers or earphones are on. Here's some other info for questions. Use the chat option, because if I don't get to some of your questions, we'll go back and look and make sure we get some answers out to you. I'll try to, like I said, try to leave some room for some questions at the end. For CPE, the information was on there already, but go to the Conferences IO button and check in there. Check in now. When a poll is open, make sure you submit your response if you need to. If you can't do that on your device, you can go to the QR code and go that route there for information's in the meeting chat. Make sure you check out at the end of your session, or at the end of the session, or if you leave early. Okay. Just a little disclaimer. This is informational purposes only. I'll let you all go through that. I'm not going to read through it. It's our disclaimer statement. And let's get right into it. So 5 minutes in, we'll dig into the Title 18 Part 521 regulations. Like I said, they were initially went into effect back in 2009. Updated and made effective 12/28/2022. So just over 2 years ago, we have new regulations guiding us, regulating us for our compliance programs for those that are required providers. We'll talk about that in a little bit. What's new in these regulations? Mandatory compliance program requirements for required providers. So those are Articles 16, 28, 31, and 36 clinics and Medicaid Managed Care Organizations, as well as anyone receiving $1 million or more in annual Medicaid revenue. So those are big ones. It used to be $500,000 or more for providers. Now it's up to $1 million. But anyone who's an Article 16, 28, 31, or 36 clinic, regardless of the annual dollar amount for Medicaid, you're required. Something else new, comprehensive assessment of the overall effectiveness of your compliance program. It's required, and it's required to be done on an annual basis. That's something that people are missing at this point, or just choosing not to do it. That's a big one. You need to do it. It needs to be done on an annual basis. Compliance committee is now required. We've been talking I've been on a DO for over 18 years. And we've been talking about a compliance committee and having a good idea in the previous regulations. It wasn't mandated. Now it's a requirement in these updated regulations. You have to have a committee charter. You have to meet on a quarterly basis, comprised of senior managers, and your committee charter has to be reviewed annually. Compliance officer has to report to the board quarterly, report to the executive director quarterly, report to the compliance committee quarterly. Can be done in person, can be done in a quarterly report in writing. Your compliance officer doesn't need to be an employee anymore. It can be an outsourced position and so on. So previously, it had to be the compliance officer was supposed to be a W-2 employee. Now it doesn't necessarily have to be that way. There are now fines and penalties, dollar amounts associated for not having an effective compliance program, which is one reason why OMIC now requires an annual effectiveness review of your overall compliance program. First offense of being deemed not having an effective compliance program is $5,000 a month up to 12 months. Second offense and so on is $10,000 a month up to 12 months. So there's some teeth behind these regulations now. If you're not aware, your senior leadership should be aware of those fines and penalties now. Your board should be aware that if you don't have an effective compliance program, you could have these fines and penalties applied. Your policies and procedures, your compliance program policies and procedures, and your standard of conduct need to be reviewed on an annual basis. Most people review their policies and procedures on an annual basis, read it, yep, we're good, and move on. Now there's certain things that you need to document being done related to your annual review. It has to be documented that you do it. You have to document any changes that you make. What were they? You have to document whether or not employees are following that particular compliance policy and procedure and standard of conduct. And you have to make the determination for those policies and procedures and standard of conduct. Are they effective? And how do you do that? Well, you have to do some level of testing. You have to gather data, and you have to look at what that data is telling you and what that testing is telling you. The state Office of Medicaid Inspector General is very keen on corrective action plans and following through with your corrective action plans. What were your findings? What actions did you put in place? Did you follow up? And were they working? An annual compliance work plan is now required under these new regulations. Okay, now we have our poll question number 1. What is required to be performed annually to assess the effectiveness of a compliance program? Okay, the poll will remain open for a little bit. You need a compliance program assessment and a comprehensive assessment of your compliance program. Okay, continuing on, what's new with these regulations? An annual training plan is required. You have to document that you're reviewing your training plan and updating it every year. Annual audit plan. What are you auditing? Are you auditing and monitoring activities? Exclusion screening is to be completed promptly upon hire and every 30 days thereafter. For those that don't know what exclusion screening is you're checking state and federal databases to determine if employees, contractors, vendors, whoever have been, if they've been restricted from participating in the federal healthcare programs. That's exclusion screening. It has to be done promptly upon hire and every 30 days thereafter. We had some clients in the past that made some determinations that they were only going to do exclusion screening on a quarterly basis. If you made those decisions in the past, because it wasn't, it wasn't set in regulation, now it's set in regulation every 30 days after promptly upon hire. There's now extensive formal self-disclosure protocol that's required to be followed for any identified overpayments. You have to do those. Let me go back to the self-disclosure protocol. Just want to make sure I emphasize this. There's a brief disclosure form and a full disclosure statement form. These are for any identified overpayment. That should be bolded and underlined. Any could be rate adjustments, could be just errors and omissions in your documentation. Anything you identify needs to be paid back. For the simple ones, your routine ones that you would normally void and adjust, you still do that, but at the end of the month, you have to submit to OMIG the brief self-disclosure protocol form. That's a requirement. For more extensive, comprehensive, or complicated things you identify, you have to complete the full disclosure statement form. More comprehensive. Those are required. Check with your billing and finance department to make sure it's getting done. One of the easiest ways to get audited is if you've never completed one. You never completed a formal self-disclosure. So it's important that those are being done so you're not put on any radar list from OMIG. So before we get on to our workforce survey results, question, can the audit plan be incorporated into the work plan or should it be a separate document? I like separate documents, but it doesn't preclude you from putting in your work plan under your auditing and monitoring component in your work plan, your audit plan. It's as long as it's there, it's documented. I don't see a problem with that. Okay, our workforce survey results. We did some workforce surveys for folks. We had opportunity for people to do them as well. We do them typically for our compliance program effectiveness reviews that we do for our clients. And we've gathered some information throughout 2023 and 2024. And it's utilized and used the data results not only from a particular provider perspective, from aggregate results to benchmark your own organization. You can identify opportunities for improvement. If you're not doing a survey, you really should. It's part of determining whether or not your compliance program is effective, and also identifying opportunities to make corrections to bolster your compliance program. Use the data to document and implement corrective action plans. So like I said before, OMIG is big on corrective action plans, following through with them, and doing follow-up. Survey results are a good way to identify some areas that need improvement, and you can focus in on those areas in your next work plan, or when you update your work plan throughout the year, to key in on some areas that maybe you've identified through survey results that should be improved. So these are some results that we had, and as I go through some of these results, and I'll make some comments about what I think it means. And certain areas we have some good results. We have some results that from an aggregate that really you could take into your own organization and say, well, if these results were like this for other organizations, and perhaps it's similar for our own organization. But we really encourage you to do your own survey or have it done for you, and utilize these results to kind of look into your own benchmark your results against kind of an aggregate. All right, so we've asked the workforce, do you know what it means to have a conflict of interest within your organization? 92% said yes. So that's pretty good, right? Well, we have 8% that says no or unsure. So I usually use the benchmark or the line of demarcation of either 90 to 95%, because you definitely don't want 10% saying no or unsure. This is right in that range. So there is opportunity for improvement here. You want everyone to know what it means to have a conflict of interest in your organization. Is it okay for your organization to receive payment for services that wasn't provided? 97% said no. So I think this is in a good range. We like to see that. Um, Compliance and ethics are of utmost importance to the organization's operations. We have, again, 7% that disagree, strongly disagree, or unsure. Um, with decent results here, but again, there's some opportunity where, there's definitely some areas where people are strongly disagreeing, or they disagree, um, or they're unsure, where, I would key in on some of those things to make sure that you're doing what you can to demonstrate that compliance and ethics are important to your organization, and everyone understands that. Now, there is room for some errors on either end, outliers per se. There's always outliers, so that's why I kind of use the 90 to 95% threshold as areas that can key in on. The organization provides adequate and timely communication of regulation changes and related policy and procedure changes and updates, such as compliance program regulations. Did everybody get trained that there's new regulations and new requirements? Those are some program regulations that change, and so on. People need to know, your staff need to know when things change. And this one, we have 17% that either disagree, strongly disagree, or they're just unsure. That means they're not getting communicated with in some instances. Your immediate supervisor encourages compliance and ethical behavior. Again, 9% or so that disagree, strongly disagree, or they're unsure. We really want those things to come to the forefront. These are kind of all related here. People need to understand that compliance and ethics are an important part of your organization. We don't want any gray area here. Any type of behavior preventing another person from engaging in good faith reporting of compliance issues and concerns violates my organization's policies and procedures. Again, this is an education piece. We have 10% that were unsure, disagree, or strongly disagree. Really, they need to understand that what the process is, and encouraging reporting, encouraging people to participate. Everyone needs to know that. Do you know how to make an anonymous report of a compliance concern or suspicion of improper conduct within your organization? No or unsure, we're 22%. To me, this is a big area. When OMIG does their site reviews, they walk around your facility and look for flyers, they look for hotline posters, they look for means of reporting. These are requirements in the regulations to have these things available, and a means to report published and available for not only for your staff, but recipients of Medicaid services. So this is a big one, 22%. This is an area that, as an aggregate, if it's an aggregate survey results, it means potentially it's happening in your own organization. People aren't aware of this. So making them aware, and educating them and using that as an opportunity for improvement. Do you know the procedure steps the organization should take once a suspected compliance issue is reported? 28% were no or unsure. This is something people need to know. This is kind of a training component. What are people being trained on, and are they being trained on the required components that are in the regulations? If you're a new hire date within the last 6 months, did you receive compliance training within 30 days of hire? 18% were no or unsure. Now, we've had some instances where our clients, providers, organizations have labeled their training something else besides compliance training. You want to be consistent with their message, consistent with the regulations. If somebody's saying labels their compliance training as ethics training, well, when an external entity, a consultant or a government entity asks any one of your staff person, um, did they get trained in compliance? Did they receive compliance training within 30 days of hire? It needs to be clear. This is compliance training. You don't want anybody to say, no, I didn't do that, or no, I don't know. I don't know. So you have to be clear on what the training is called and be consistent with the regulatory environment. All right, poll question number 2, true or false? A compliance officer must be an employee of the organization. Back up for a second. We have some folks that are saying true, 15, 16% saying true. That's what's false. So under the new regulations, or the updated regulations, does not have to be an employee. So moving on to a compliance officer survey, we had over 100 compliance officers complete our survey. Remember, the results I just went through were the workforce survey. The entire workforce of organizations were surveyed. Typical response rate for those that are interested, we typically get between 20 and 30%. I think 30% response rate in surveys is a good response rate. Obviously, higher you get more complete data. When you get down to 20%, there's room for improvement. 25% is okay. I think 30% and over is really good. So it's, kind of just benchmark your own survey results. Obviously, the more time and more prompts to complete the surveys, the better results you get. But oftentimes you don't have an endless amount of time. So just keep that in mind. I think a 30% rate is pretty good for organizations. All right. So like I said, we administered a compliance officer survey. This is our 4th one we've administered over the last 8 years or so. So we're accumulating good data over time. Like I said, we had over 100 compliance officers complete the survey. And you can use these results to benchmark against your organization against others and where you fit in. I'm going to dig right into some of our survey results. What's the annual revenue of your organization? We had a pretty good cross section of revenue completing the survey of organization types. How many FTEs does your compliance program have? Again, it correlates with the size of often with the size of the organization. So good data to you could pull out different data for your own organization. Are you the compliance officer part of the senior leadership team? We have some good data that shows this is progressive, 77% back in 2014. So this is our 5th one. Sorry, I said 4th. This is our 5th one. We typically try to do it every couple of years. We had started back in 2014. So it's good to see some progression in this aspect. It shows the importance of the compliance position and shows the emphasis and authority being given to the position. How many years have you worked in the compliance field? We're seeing a maturing of the field. People have been in the field longer. And more, I guess more people have been in the field for an increased number of years. I like to focus in on, the 6 to 10, 11 to 15, that a lot of folks in that bucket. And then you can kind of see the shift as we go forward from back in 2014. How many years have you been the compliance officer at your current organization? Again, we have some pretty big numbers between the 4 years to 15 years and over 15 years. People the field has matured. Before, back in 2014 and earlier, people were kind of just told, you're taking this on. Um, Now we're actually seeing education programs at colleges and universities specific to corporate compliance. So um, back in the early start in 2009, when regulations first came out, we didn't see that very often. It was hard to get training. It's one of the reasons we started at Bonadio our compliance program development series in the fall and our compliance boot camp in the spring, is to provide education for the compliance department, the compliance officer at the time, and now it's more the compliance field. We've expanded out our target audience because it's the compliance role has encompassed, as many of you compliance officers know, encompassed more and more and more responsibility on your shoulders. Boy, rolling through these poll questions. Number 3, how much experience do you have as a compliance officer? For those that are compliance officers, or for those that know your compliance officer and how long they've been in the field. So good, good. It looks like we have a bunch of 0 to 2 years as compliance officers, and you participating in these kinds of seminars and grasping as much information as you can is a good thing. It's you're being proactive, and for those 10 plus years, 15%, 6 to 10 years, 10%, 3 to 6 years, 11%. That continued education. One of the things in the regulations now is specific to the compliance officer training. These are trainings for you. Retain this documentation to support your own education, your own continued education in the compliance field. Annual compensation. We have seen some progression, and again, it's correlates to the size and complexity of the organization, but we can really see the progression of the salaries in the field, and that's we have more experienced people, we have more educated people specific to compliance, certifications are available, and so on. So it really makes sense that back in 2016, 15.9% were under 50K. Now we have 1.9% under 50K. So, it really, this to me shows the maturity, the maturing, the progression, and the value that you compliance officers bring to the table. And, the salary progression has shown, and also salaries have increased over the years too. So, I don't want to just discount that piece, but it is indication of where the field has gone and the value and importance of the field. How many employees does your organization have? This is just showing the demographics of those that took the survey. Does your compliance program have a separate cost center devoted to compliance? It's kind of held steady over time. We like to see a separate cost center, separate budget for compliance. One of the things in the updated regulations that you have to determine is enough resources being devoted to your compliance program activities. Resources meaning staff resources, finances, and so on. That's how are you able to demonstrate that officially? If you don't have a separate cost center, just kind of a hodgepodge. We'll dump it in here, we'll dump it in there. But you, part of your compliance program, your compliance committee, have to assess the resources. Is it adequate? Is it effective for your organization? And being able to demonstrate that effectively is a requirement. Annual budgets. Some we still have no, but you can see that pretty big decline from 2000 back in 2016, 2014. for those $100,000 or more, $50 to $100,000. Those are the big organizations. But you can see that that number where there's $0 dedicated specifically to the compliance program has has shifted downwards, and we expect that to continue to get lower as we go. And here's that question. Do you feel you've been provided adequate resources to carry out the compliance function effectively? That's a question that you, the compliance officer, and your compliance committee have to have that discussion and document. Do we have adequate resources? Yes. Well, why? How do you know? What's the determining factor? And if you do say no, well, what does that mean? Why don't you? What's needed? And what's like I said before, Omega's keen on corrective action plans. Well, if you don't have adequate resources, what's the plan to get there? Something has to give. In our survey where we have 55% saying no or unsure if they have adequate resources. Well, you're the compliance officer. Why are you unsure? That's part of the compliance program effectiveness review that you're required to do on an annual basis. It's part of your compliance committee responsibilities to have those discussions. So you need to be sure. That's the requirement. Really, I think as we get more educated and more attuned to the regulations and the requirements, you see this drop off from 2022 to 2024. I think that's regarding the specificity. I think that it's an indication of the specifics in the compliance program regulations, the Title 18 Part 521 regulations. So now we're more aware what's required, what do we need to do, and so I think that's where the drop off. Hopefully, we see a shift as we get further along with these updated regulations and what's required, and those corrective action plans put in place and taking hold. Hopefully we see that go the opposite way. Do you, the compliance officer, have other responsibilities outside the compliance function? 85.3% say yes. I mean, that's been indicated throughout these survey results. We all know, and every compliance program is different. What falls under compliance program auspices is unique to your organization, whether it's investigations, incidents, HIPAA, HR, whatever it might be, or everything, depending on your organization. You have to assess the effectiveness of your role, the compliance officer, taking into account all your other responsibilities. And one of the big questions that I've been aware of from OMIG is, well, if you do this, and this, and this, how do you have time to have an effective compliance program? Those are some of the questions when you do wear all those hats and a lot of different things are put on your shoulders. You have to be able to answer, how do you manage your organization's compliance program, and how is your compliance program effective based on all the responsibilities you have? And I know I've talked to many compliance officers every year. We do this, we do this, we do this. Some more recent are saying most, if not all, of their time is spent, for those in the developmental disability area, a lot of their time, almost all of it, is spent on incidents and incident investigations and report writing. Well, how do you have an effective compliance program in all the other areas that you're required to be overseeing the compliance activities? What do you do to be effective? Those are questions you have to answer. You have to have discussions with your compliance committee about how to do that. What do we need to do to get us to be effective? What documentations do we need? What additional resources we have, as we just saw in some of the other survey questions, to get us to where we need to be to have an effective compliance program. Document. That's the critical component of your compliance program requirements, the Title 18 Part 521, determining effectiveness and demonstrating effectiveness. You have to document, you have to gather data, you have to trend that data, you have to put in corrective action plans where necessary, you have to follow up. Are those corrective action plans working? Excuse me. Is the compliance function involved with the organizational strategic planning process? We have 25% that we either know or unsure. Compliance programs and effectiveness are critical to your organization, required. If your strategic planning is calling for new programs or getting rid of programs, that's affecting your compliance program for sure. And if you're not part of that process, all of a sudden you have a new program come in, new regulations, new oversight, new contracts, new responsibilities, and then all of a sudden it's dumped on the compliance department to manage. But what does that mean? Potentially, the effectiveness of your overall compliance program is diminished because now they're devoting the whole time to get quickly up to speed on this new thing. And what are the requirements? What is the impact? So part of that strategic planning process should include compliance to determine what's the impact on our compliance program. What are we going to need? Is our now resources to carry out the compliance function, is that shifting because of these new programs? Or the reverse, we got rid of these programs, so now what does that mean for our compliance program? Just stuff to consider, that if your compliance officer and the compliance department is not involved in that strategic planning process, some things may be overlooked, and or you'll be in a big scramble once those things take hold. Does the compliance function have a succession plan in place? No or unsure. Almost 70%, 69%. We've seen oftentimes where the compliance officer abruptly leaves, something bad happens, health issues, whatever it might be, or they go out on leave, or compliance department staff. It's an important piece. You don't want all of that knowledge that your compliance officer has. And a lot of times it's not just your compliance department, it's your compliance program. They have wearing all these different hats. If there's not a succession plan in place, you're here and it drops off, your compliance program effectiveness. So it's very important. It's important for your whole organization to have a succession plan in place. But we're speaking specifically regarding your compliance officer and your compliance function. What happens if your compliance officer is no longer there and it's sudden? There's a lot of preparation, a lot of internal knowledge that people have, not just in your compliance program, all over the place, but the compliance officer has, and whatever duties and responsibilities they have. How would somebody step into their shoes tomorrow? They're not there. And, what's the plan? And how can you, instead of having a 60, 90, 180-day gap, what can you do to fulfill those gaps, to make sure that your compliance program, as required by law, continues to be effective? So these are things that need to be considered. And based on 69% of the compliance officers responding to the survey saying that there's not a succession plan in place for the compliance function, that's something that should be considered, should be part of your at least initial discussions for your 2025 work plan. Have those initial discussions. What does it look like? What would a succession plan look like for your compliance department, your compliance officer? Start those initial discussions. Do you, the compliance officer, have the opportunity to go in executive session? All management removes the room in person with the board of directors at least once per year. 63%. We've gone up from 46.5% back in 2014. Now we're at 63%. This goes back to having unfettered access to the board, to the governing body. The board needs needs to be able to ask some difficult questions to the compliance officer. You know, some of it's related to some of these other surveys we've seen. You know, resources. Do you have what you need? Are you getting the support you need? Blah, blah, blah. The board needs to be able to ask those questions, and without other management stepping in and answering for the compliance officer. We want that unfettered access. You need to demonstrate. This is a good way to demonstrate the involvement of your board, which is required in the regulations. No longer is it okay for your board to just sit back and listen to compliance reports. We want to, OMIG wants to see that interaction, discussion regarding your compliance program activities, and discussion regarding the effectiveness of your compliance program. You know, that active discussion should be documented within your board meeting minutes. Executive session is a good way to demonstrate that unfettered access to the compliance officer and your compliance program activities. Does your organization perform an annual organization-wide risk assessment? Well, in the regulations, it says your audit plan, your auditing and monitoring should be risk-based. You should be developed based on identified risk areas. And how do you do that? Well, you need an organization-wide risk assessment. And we had close to 30% saying they were either no or unsure. Now, we're at 70% yes. This is a requirement. You know, how do you determine your auditing and monitoring activity if you have not assessed the risk of your organization? That's the bottom line. Do you, the compliance officer, believe that your current auditing and monitoring process is sufficient for an effective compliance program? We just talked about being risk-based. And, you know, we have 38% saying they're no or unsure whether their current auditing and monitoring process is sufficient for an effective compliance program. It's a required component. Assessing effectiveness is required. Your auditing and monitoring process is an ongoing process, and assessing the effectiveness of that is ongoing. So if you have programs that change, or you've identified risk areas, you know, even now, January 30th, you've already have your compliance work plan done for 2025. Well, you've identified new info or new risks. You might want to add that to your work plan right now. So your work plan's a liquid document to be changed based on the needs of the organization. Your auditing and monitoring process needs to be flexible enough to address identified risk areas that you identify throughout the year. Constantly reassessing, constantly documenting those risk areas. And what are you going to do about it? Does your compliance committee include a board member? We've kind of gone up and gone down with this one. We're about 50% either no or unsure. It's not required, but it is a good way to demonstrate that involvement of your governing body. It's always good to have someone from your board on your compliance committee. And I'll leave it at that. It's that communication and access to the compliance program activities for your board. Okay. Have you implemented a process to assess the overall effectiveness of your compliance program? 27% say no or unsure. Again, this is a requirement. It's just like any other regulation that your programs operate, any other requirement, state, local, federal regulation requirement. Assessing the overall effectiveness of your compliance program is required for the 521 regulations. Does your compliance program utilize data analytics to assess effectiveness? Well, If you're not using data to determine whether something is effective, whether it's your policies and procedures and standards of conduct or your overall compliance program, um, how are you making those determinations? So using data that you gather throughout the year to make those determinations is critical. First question I would ask, okay, you say you're effective. How do you know? Well, we know because we do this, this, and this. Okay, prove it to me. Prove to me that you do this. Prove to me that you audit and that you're assessing the audit activity. You're assessing your findings. You're putting corrective action plans. All that documentation is data that you're gathering to make those determinations. And how do you know that this year is effective compared to last year? Okay, so trending data, gathering data, and utilizing it is critical. All right, so we're winding down a little bit, and I promised some time for questions. I know there's some chat questions that we want to address, but some questions to ask your compliance officer, to ask the compliance program. If you're senior leadership, if you're not actually a compliance officer, um, and you don't know the answer to these questions, do we have an effective compliance program? Like I just said, using data. How do you know? What information is gathered to make those determinations that we are in fact effective in what we're doing? That information should be going, and it's required now to report quarterly to your compliance committee, your executive director, and your board. So if you're part of the senior leadership, you're part of the board, your compliance committee, and you're not getting those quarterly reports and having discussions, please make sure that you're doing that. Ask questions about the quarterly and annual reports. What's our process? How is it documented? Where do we have that? And then it's always good for the leadership to ask the compliance officer, for anyone to ask the compliance officer, whether it's the compliance committee or the board, what are the top 3 to 5 risks we have as an organization? Okay, we got 5. What are we doing about them? What's in place? What's our corrective action plan? What's our follow-up? What are we doing to mitigate those risks? When you do an organization-wide risk assessment, you need to prioritize those risks that you've identified. You may have some immediate action that that has to take place now. You may have some, it's a risk, but low risk, really not much we can do about it. We look at it, we assess it, and you move on. So you really need to prioritize your risks and identify especially those immediate needs that need to take place, those high risk areas. So right now, you should be wrapping up 2024. That compliance program effectiveness review process should have been started or should start very soon for 2024 activities. Make sure your contracts are updated to include termination for noncompliance. That language has to be in there, or needed to be in by 12/31/2024. If you don't know what that means, refer back to those Title 18 Part 521 regulations. Your contracts now need to include a termination clause for non-compliance with your compliance program activities. Review your last year's effectiveness review process and determine what changes and efficiencies can be made before you begin this process. What did you complete any corrective action plans? Did you follow through with those corrective action plans from last year's process? Put in your work plan for this year. If you haven't done one already, conduct a risk assessment. If you've done one, make sure that any findings in there, you've updated your 2025 work plan, you updated your audit plan, training plan with those findings from last year. Assess your current resources, identify any gaps, look to see, did you add programs? Did you delete programs? And how does that affect your compliance program and your compliance program needs? In summary, there's more regulatory emphasis on maintaining an effective compliance program. I probably said that at least 30 times, effectiveness. There's more emphasis on it. We are seeing OMIG auditing compliance programs and what that entails and what they're expecting. Your effectiveness has to be evident through your documentation, your outcomes, your corrective action plans, resolutions, um, and means of data, means of measuring effectiveness always is dependent on the size and complexity of your organization, your industry sectors, your risks, your resources that you have available. Remember, your compliance program has to be, um, we have an acronym now, safe, effective, scalable, affordable, feasible, and enforceable. We have the set of regulations that guide us, that mandate us, but it's not a one size fits all. So it's constantly reassessing your activities, your effectiveness to your personal compliance program. Documentation is key. If it's not documented, it didn't happen. That's critical. Now, especially with these updated regulations where we have to assess the effectiveness of the compliance policies and procedures and standards of conduct on an annual basis, conducting an overall compliance program effectiveness review on an annual basis. Documentation that it's being done is critical. Poll question number 4, true or false? Documentation is key. On to so just some stuff that we can do. We host hotlines. We do assessments of the effectiveness of your compliance program. We chair compliance committees, conduct risk assessments, administer workforce surveys. Anything compliance program related, we do. So we are of help. We fill the gaps where needed, and we're always available. Any questions, you can contact me. Now I'm going to look through the chat and try to address most of these questions. Are there templates or best practice for the work plan, training plan, and audit plan? Yes, if you need some, you contact me. We do have some templates that we've created, so we can talk about that. Can you explain what is meant by mandatory reporting under risk areas in Part 521? Is this just related to self-disclosures? Yes, it's related to self-disclosures. Again, any identified overpayment has to be paid back. If you identify an overpayment, you have to do a formal self-disclosure now when it's related to Medicaid or Medicaid Managed Care. Is it mandated to have a board member as a committee member, or at least recommended? We recommend it. It's not mandated under the 521 Title 18 Part 521 regulations. I think it's a good idea. It demonstrates that they're involved. It's not required. Okay, let's go back. Are there any recommended programs to collect data? There's getting to be more and more vendors out there that are claiming they have a compliance program software. Just be careful on what you're really take a look at what it is you want to come out of a software application. There's many out there. One of the things we found when we have been actually looking for things for our own consulting activities and compliance program activities is the reporting component is lacking in many software applications. And that was the main thing that I wanted in doing my work. And some of it is outsourced compliance officer activities. Some of it's related to auditing and monitoring. It's the reporting capability to be able to print a report to give to your board, to be able to print something to senior leadership and the program level and varying degrees of information. So those things is something that I look for, but you should look for something that fits with your organization. What are your needs? What are you looking for it to do? The board must have compliance training within 30 days of becoming a new member and then annually thereafter. Compliance training for new hires has to be done promptly upon hire is what the regulations state, and then annually thereafter. The 30 days with exclusion screening has to be done at minimum every 30 days, and so on. But compliance training is annually. The board has to be trained annually. I would say within you define within your own board bylaws when they have to receive the compliance training, but they need to receive it when they are onboarded. Suggestions of self-disclosures have been submitted, but there has not been any communication back from OMIG. Just document. I would reach out to see what's going on and have that documented and saved to your files. Sometimes related to self-disclosures, and I was just on a call yesterday with the client and talking about sometimes it might be 6 months before you hear back, or a year, or they've accepted the self-disclosure and you're waiting for how to pay the money back or when to pay the money back. So, it's sometimes the OMIG goes really fast within a few weeks or a month, and sometimes it's several months. Next question, do you recommend the board review, approve all agency-wide policies or only compliance policies? That's an internal decision of what you put in your board bylaws and your organization's requirements. For sure, I think it's a good idea. Now, all policies and procedures, I think that might be going a bit beyond. That's all your board would be doing. So, you have to decide internally what responsibilities you're going to put on your board for that piece. If my org has not yet received Medicaid revenue, what do you recommend in terms of estimating, projecting revenue moving forward? Well, this goes, there's some new programs coming out that are Medicaid revenue generating programs. I would start right off with taking the Title 18 Part 521 and implementing a compliance program. You can scale it to your organization, but also be ready to ramp it up when you need to. So it's always a good idea to have a compliance program. It's not just Medicaid. There's many organizations out there in all different sectors and industries that have compliance programs, not just for Medicaid. It's triggered by Medicaid in New York State. However, there's a lot of benefits to a compliance program, and many organizations have bigger risks, financial risks, outside of just the Medicaid funded programs. So I'll leave that at that. How can we get proof of attendance for this training? I think that's going to be sent out. What if training and attestations are sent to vendors, but there's no response? Doing your due diligence is what you need to document. And sometimes if vendors and you're unable to get that back from vendors, you document when you sent it, what you sent, and I think you're fine on that front. Does the $1 million threshold count only those funds that are billed on a fee-for-service basis? Or we're out of time, or I'll just ask, this will be the last question, or any funding received that ties to Medicaid? That's a very good question. That's one that is being asked. Previous regulations said direct or indirect Medicaid dollars. So that covered any kind of funding stream. So I know there's programs out there like the care coordination, health homes, 1115 waivers that are coming out that are funneled, the Medicaid dollars funneled through other channels. Very good question. And I think that's one that we got to get answers from OMIG as far as that indirect Medicaid dollars where compliance programs used to be required for that. So you have straight Medicaid, you had Medicaid Managed Care Organizations, those dollars count for being the Medicaid dollars, and then you have other pass-through areas. Those are the big questions. So if you have any other questions or follow-up questions, feel free to reach out to me. If I don't have an answer, I'll try to track down for you. And if you have any other questions, just reach out and we'll try to track down things for you. Again, make sure you check out of this meeting for those CPE credits. Thank you for your time. I hope it was informative, and enjoy the rest of the series.